Radium-223 was approved 10 years ago, based on survival benefit that was done in the patient population, kind of end of line. I remember when it's first approved, everybody want to get it.
Yeah.
Because in the phase 3 trial, people on the placebo arm, has more side effects than people on treatment. Again, that's back to the old days. There are not many treatment options, so the control arm is supportive care. So do you guys still use Radium-223? It's not a great PSA decline.
Probably less. I mean, our radiation oncologists in our center, we have centers within FCS that offer this. Not all the centers do. The center I operate out of does offer both, but we've used a lot less Radium-223 because the Pluvicto has been so effective in both bone and visceral. See, radium only was effective for bone, but this one is for both. So we've generally tended to go first with that. So I can't remember the last time I had a patient who had to take Radium-223. It's been a while.
And we were fortunate enough to have early access to Pluvicto when there was a fight trying to get the dosing and stuff. Along with Moffitt, we were the other institution to be able to get it. So it's been more Pluvicto and less. And just like Dr. Malhotra, I can't remember the last time I've sent a patient for Radium-223. So.
Yeah.
And cytopenias are probably bad with both, but I think there's somewhat a little bit maybe less than with Pluvicto. I don't know the data. There's a head-to-head difference.
Yeah, there's no head-to-head comparison. Yeah. There's a chemo versus radioligand therapy. Radioligand therapy tend to cause slightly more thrombocytopenia. Right. Chemo tend to cause more anemia. But I think for younger guys, you want to running a marathon. Yeah. So sometimes you have tools, just like Jad said. If they're doing well, a few bone mass, that can be something to consider, because you don't worry about too much bone marrow toxicity because you have probably looking at a long-term battle, maybe another 5-7 years down the road. Yeah. So I think you probably heard about P3 data, that was presented comparing Radium-223 plus ANZA versus ANZA to show the, radiographic progression-free benefit, and there's some OS signal as well. Again, the caveat was done in the patient population who didn't have ARPI in the castrate-sensitive setting. So have you tried any of these combinations before? Or in the old days, when we don't have Pluvicto, we know the radium, the PSA response only 16% in the phase 3 trial. Have you ever combined with IB or ANZA?
I have not.
I have not either. No experience. How about yourself? Have you had experience with it? Maybe chatters.
Yeah, I've tried it a couple of times. I trained with an institution where Radium-223 is believed to work on the bone niche.
Yeah.
Scientifically, kind of look at it. Dr. Lucadidis is like a true believer, so I have that in me, and I try to sneak it in. As you said, in some of those patients that may have a long marathon to run, young, and you have the opportune time to sneak in therapy where PSA increase. Again, you have to tell the patients and tell them hey, you're gonna see your PSA go up. Don't freak out. It's okay. We're expecting that. Where you have to trust me that there is an OS benefit to what we're doing. Yeah. But yeah, not with Pluvicto use has gone down. As you said, it's only for specific patients who have bone only, no visceral mets, and Pluvicto is now the more flavor in
current flavor of the month.
Current flavor of the month.
Yeah.